Chair, you now have quorum.
Super. We'll go ahead and it's exactly 2:30, so it's perfect. I'll go ahead and call the meeting to order. Good afternoon, members. Good afternoon, members of the MAG Human Services Technical Committee. This meeting is now called to order. The meeting's being recorded and is live streamed on YouTube as a way for members of the public to participate. So please state your name when making a comment or asking a question, and please keep your microphones muted as well when you're not speaking. This way we don't have any issues and can hear everyone. And we will now begin the meeting with a roll call of all members. Kelly or Dylan, will you please do the roll call?
I'm happy to, Chair. Thank you. Cindy Sabarino on behalf of Mary Lynn Kastanek.
Here.
Jerry Guajardo. Karen Bishop.
Here.
Autumn Grooms. Melanie Dykstra. Christina Panatescu.
Here.
Thank you. Renee Benavides. Susan Hallett. Kristen Charlau.
Here.
Thank you. Eliana Godinho. Rachel Sanders.
Here.
Thank you. Melanie, I believe I called you.
Here.
Okay, thank you. Did I miss anyone else in roll call? Okay, thank you, Madam Chair. You have quorum.
Super, thank you so much. All right, we'll move on to item 2. Oh, before I move on to item 2 of the agenda, I do want to welcome Kristen. Thank you so much, Kristen. She is, Kristen's with the City of Tempe and is the Care 7 manager. So welcome to the HSTC as a new member. Really appreciate you joining us. And Kristen, do you want to share anything else about yourself with the committee?
It all started in a small town. No, I don't. I think that I just am so thankful to be invited to the table. I have worked in human services at the City of Tempe for 25 years. So we are taking a little bit of innovation to heart in Tempe and trying some new things. And so here I am at your service and excited to learn more about what the committee does.
Thanks so much, Kristen. And like I said, so glad to have you on there. Know of how much that the Care 7 team is doing. And when you say being innovative there in the City of Tempe, that is an understatement. So welcome. And
every day brings something new. Every day.
Yes, I'm sure it does, as the rest of us can attest in the day and age that we're living in this point. All right, folks, we'll move on to item 2 on the agenda. So this is our call to the audience and an opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda or that are on the agenda for discussion and not for action. Members of the public could submit written comments via the MAG website up to 1 hour prior to the meeting. Kelly, do we have any written comments?
Madam Chair, we did not receive any written comments.
Okay, very good. Thank you very much. And we'll go ahead and move on to agenda item number 3, and that is the approval of the meeting minutes. And so we met as a committee on August 11th, 2022. Does any member of the committee have questions or comments regarding our meeting minutes from our August meeting? No? All right. I'm hearing none. Is there a motion to approve the minutes?
I'll make a motion to approve. Melanie from Gilbert.
Thank you, Melanie. Do we have a second?
I'll second that. That's Rachel from City of Buckeye.
Thank you, Rachel. We have a second. Staff, can you please take a roll call vote? Kelly, could you do that?
Yes, Madam Chair. Just one moment, please.
And I see that we have, as you're getting that, I see that we have a few additional members that have now been able to join us as well. I see Renee, Eliana, and Jerry.
And Madam Chair, I did also want to mention that the Human Services Technical Committee has met since August 11th, but it was a special committee meeting and there were no minutes taken at that meeting, just for today's minutes.
Thank you for clarifying. I was at that meeting as well, but thank you for making that clear to the committee.
No problem. Okay, Madam Chair. Cindy Savarino on behalf of Mary Lynn Kastanek.
Aye.
Jerry Guajardo.
Here.
Jerry, how do you vote on the minutes?
Oh, I thought we were doing roll call. Aye.
Thank you. Karen Bishop.
Aye.
Thank you. Melanie Dykstra.
Aye.
Thank you. Christina Panatescu.
Aye.
Thank you. Kristen Charla.
Aye.
Thank you. Eliana Godinho
Aye.
and Chair Edwards
Aye.
and Rachel Sanders.
Aye.
Thank you. Did I miss anyone?
Renee.
Apologize. Renee Ayers, Benavides.
Aye.
Thank you. Madam Chair, minutes pass.
Very good. Motion carries. Thank you, everyone. We will move on to agenda item number 4. So this is that housing and health equity for older adults. And a summary is being provided to us of this report by Bailey Hugh from the Harvard Joint Center for Housing Studies. Thank you so much, Bailey, for joining us today and presenting this information to us. This is, I'm really excited to see it. So thank you, and the floor is yours.
Thank you. Thanks for having me. It's kind of fun to sit in on this meeting. Yeah, so I'm here from the Joint Center for Housing Studies at Harvard to talk a little bit about our latest report, which just came out last Thursday, actually, called Housing and Health Equity for Older Adults, Pandemic Innovations and Policy Ideas. And I'm a research assistant at the center. I've been there since last May looking at topics related to housing for older adults. And I've been working on this report since then, so it's kind of nice to see it go out into the world. Could you go to the next slide? Thank you. So this is just an overview of what's in my presentation today. First, I'll just talk a little bit about who the Joint Center is and also our partner, the Hastings Center. I'll introduce our project and then talk a little bit more about the details of the project and end with some examples from the local and state level across the country of what we've been looking at, basically. Next slide, please. So I am part of the Housing and Aging Society program at the Joint Center. In case you're not familiar with us, we do research which informs policy making on a variety of topics. And then one of those teams looks specifically at topics related to older adults. So right now we look at a kind of a range of things, including policy, urban planning, design, and public health. And on this report, we partnered with the Hastings Center, which is a bioethics research institute in New York. And then Nancy Berlinger is the person there that we've been working with the most. And she and Jen Malinsky, who leads the Housing and Aging Society program, and I are the co-authors of the report. Next slide, please. So we call our report the COVID-19 Review of Equitable Community-Based Aging Policies and Practices, or COVID-19 Recap for short. So this is just another name for our project. And this project actually started back in 2020. If you could click, I think the first bullet will come up. So back in 2020, the Joint Center in Hastings also worked together to convene a network of researchers and professionals working in housing, aging, and public health. And this network of people was really instrumental during every step of this process. If you could click again. So together in 2020, the network and Nancy and Jen kind of got together to think about what we can learn from all the innovative policies and practices that are coming out during the early months of the pandemic, in order to hopefully build better systems for after the crisis was over. And of course, because we're a housing studies center, we focused on supports that are related to housing. So in 2021, we started out this research process, trying to look at things, policies and practices that apply to community dwelling older adults who we define as people who are not living in nursing homes or assisted living. So this includes people in subsidized apartments, people living in naturally occurring retirement communities or NORCs, and as well as single family homes. And we're particularly interested in things that were helpful for low and middle income households, because we know that a lot of people had trouble paying for both housing and care even before the pandemic. And then COVID-19, of course, only made these issues worse. If you could click again. So in October, or this month, we released our report with 6 broad lessons related to these points. Each lesson comes with a set of recommendations, and we try to include a lot of different examples of promising policies and practices from across the country. Next slide. If you could click again. So we kind of are guided in this research by our focus on housing, specifically housing affordability, housing safety, and housing accessibility. We also looked at services that are delivered to the home. So healthcare, supportive services, programs that address social isolation and the digital divide. Because of the evolving nature of the pandemic, we kind of had to look not only at academic articles, because a lot of things took a while, a lot of studies took a while to be released. We also looked at webinars, we went to newsletters, reports, news coverage, and we kind of did a scan of all these things, which we call a great literature scan. If you could do the next bullet. So that was our work last year, and out of that came this archive of about 200 examples of policies and practices from a really wide variety of actors, including affordable housing providers, healthcare and social service providers, government at all levels, and as well as public-private partnerships and advocacy organizations. So to kind of make sense of all this, we basically relied on our network as well as reaching out to different people. Next bullet. So earlier this year, we held focus groups, and we also reached out and did interviews. And that's actually how I came across this group, because I saw something about Age-Friendly Arizona and the Rural Transportation Incubator, and that kind of led me here. So it was a really neat thing to be able to talk to people from different areas and see what they were doing. Next slide. So this is a summary of basically our findings. Like I mentioned before, we have 6 different lessons. They cover different aspects of policy and practice, including organizational relationship building, also administrative flexibility, and even going into the physical layout and design of homes and neighborhoods. So from top to bottom, I have little arrows. So if you could just click the thanks. So our first observation is that organizational relationships were really foundational for a lot of work to happen. And specifically, age-friendly networks were really helpful at highlighting needs of older adults. And also on the ground, local organizations that were trusted by older adults were really good at disseminating information and also bringing goods and services to people. Next arrow, thanks. Our second observation is that talking to and working with older adults is really necessary to understand their needs and also tailor responses. So kind of connected to the first observation a bit. Next one. We also saw that service coordinators who work in subsidized housing and multifamily buildings were really key in connecting residents to different services, especially since so many new programs were developed or changed during the pandemic. It really helped to have a professional on site to help people navigate through that. And even people who were living in places without service coordinators were sometimes able to be served by organizations such as villages, which support people who want to age in place, which played a similar role there. Next arrow. So then the physical aspect of things is also very important, of course. Things such as accessibility of homes and neighborhoods, connections to outdoor or green spaces, and clean air and water can all, of course, impact health and well-being. And also some less obvious things, such as having a high-speed internet connection or having a resource nearby, like a senior center that you can walk to, can make a really big difference in somebody's outcomes. Next arrow. Another thing that we saw during the pandemic was that a lot of regulations changed to allow for new things such as digital signatures instead of having to physically sign a document, reimbursements for telehealth, sometimes expansions of existing programs such as SNAP or new programs such as emergency rental assistance. And we know that people benefited from these changes a lot. And the final arrow. So despite all the progress that happened during the pandemic and all the kind of people rising to the occasion, a lot of barriers still remain. So especially when it comes to cross-sector collaboration. And we can see that in different things. For instance, a lot of people who are eligible for rental assistance aren't necessarily getting help with their paying for care. So you end up with a circumstance where a lot of middle or low-income older adults sorry, might be living in affordable housing or subsidized housing, but they're not actually able to pay for the care services that they need. So this was an issue even before the pandemic, and it continues to be one afterwards. So there's this need at a higher level to establish trust and data sharing and working relationships across these different sectors. Great, thank you. So even though these lessons all cover different aspects of things, there's a common theme here, I think, which is that collaboration is really important across different levels, between different sectors, between policy makers and older adults. There really needs to be communication and coordination for things to happen. Click again. And like I said, each of these comes with a set of recommendations. I'm not going to go too much into these right now, but I've highlighted the kind of actors that we talk to. So we try to not only speak to government and public and private organizations, we also try to have some recommendations for researchers and foundations and even urban planners and developers. So I think the overarching takeaway here is that in order to enact comprehensive change, a lot of different types of people have to be working together at the same time. So that's kind of why in the report we advocate not only for concrete changes, such as changing the way that we fund organizations or changing the way that we do public engagement, but also how we think about how work is done in housing, health, and public policy. Next slide. And that leads me to this overarching concept throughout our report, which we call the housing lens. And if you could click again. This is our definition of the housing lens in our report. So we think of this as a tool that policy makers and practitioners can hopefully use, especially if you're not already working in housing, to kind of recognize the importance of safe, stable, accessible, and affordable housing and neighborhoods as well. Because sometimes sometimes the importance of the home can unfortunately be overlooked, but it's a really essential part for older adults' health and well-being. And I think it's also a useful concept because it reminds us that older adults live in a variety of residential settings, and some of these have much fewer resources or different kinds of resources. And of course, a lot of these differences come from patterns of historic or systemic discrimination, which disproportionately impact people of color, rural residents, lower income households, and other groups. So the housing lens reminds us to kind of keep these in mind as we are designing new programs and policies. Next slide. I think I'm going to skip this one, actually, if you could go to the next one. Thanks. So I'm just going to start talking about some examples that we talk about more in depth in our report. So the first one, you might be familiar with this, is the Master Plan of Aging for Aging in California. So this is different from state plans for aging because it's a cross-sector process, and it covers 10 years instead of just 4. And it also applies to older adults and people with disabilities. So in 2019, California committed to creating this master plan for aging. And they decided they would do this pretty long-term engagement campaign called Together We Engage. So they formed, I think, multiple committees, but one of the One of the largest ones was the Stakeholder Advisory Committee, which had about 80 members from local government, healthcare and service providers, community-based organizations, and also older adults. And what's kind of interesting about this example is that they were able to do a wide variety of things, surveys, meetings, legislative and community roundtables. If we could click again. And then even during the pandemic, they were able to continue a lot of these activities by moving to a virtual format. And what's interesting is that they found that some people, this actually made it easier for some people to participate, especially people with disabilities. So throughout this process, they've really tried to make sure that they reach as many people as possible. And today they actually are continuing to do this work and actually have more outreach in different languages as well. And if you could click again. So this process was really good at identifying the needs that people had. And of course, affordable housing is a really big issue in California. And during this process, the committee heard again and again that housing was a problem. So when the master plan was released last year, housing was, I think, the top priority, and as well as affordable care and other things as well. And we heard from an advocacy organization, Leading Age, that the process of gathering stakeholders and running through this was actually really useful for bringing the needs of older adults to the attention of state government. And especially during the beginning of the pandemic, when things were kind of chaotic, this might have helped to kind of focus their response efforts. If you could click again. So the engagement continues this year. And I think this is a kind of a cool example of one of our lessons. Next slide. So another example from Hawaii. So one thing the pandemic kind of showed us is how useful loose networks are. Even if the different people in the network aren't talking to each other all the time, it kind of creates this foundation that when something happens, you can more easily create partnerships and collaborations. So that's kind of exactly what happened in Hawaii. Next bullet. So before the pandemic, the Hawaii Public Health Institute created this network of age-friendly organizations. And then in 2020, members of this network then formed a coalition to address food security issues, and they called it the Kapuna Food Security Coalition. Kapuna means older adults. And they did wellness checks for older adults who couldn't leave their homes, and they also delivered meals. And if you could, next bullet. So this included government, nonprofits, and also private actors as well. And next bullet. So their scope of work actually expanded over time. Eventually, they not only did that, addressed food security, they also addressed digital inclusion and vaccination outreach as well. And in order to manage this, members of the coalition created an umbrella organization called the Kapuna Collective. So today, this collective provides technical assistance, it gathers data, and it also elevates the challenges that face older adults. Next slide. And my final example is actually international. The Toronto Community Housing Corporation is Toronto's publicly funded housing authority. And in 2020, staff from the senior housing unit started reaching out to all of their tenants on an individual basis. Next bullet. So it was a pretty large scale effort. They have 15,000 tenants, but the idea is to try to identify who has greater needs during the pandemic, or in order to be able to follow up with them. And at the same time, they were checking to make sure tenants were okay and connecting them to deliveries of food and medication. So next bullet. So this was kind of useful because it set up it gave them the knowledge to kind of do more things later on. So then later on, they started administering COVID-19 tests and vaccinations, and these were brought right to people's doors. I think some of the vaccination shots were actually done in the hallways of the buildings. So there was no need for the residents to leave their homes. Next bullet. And what's kind of interesting is out of that, so in order to administer the tests and vaccinations, they had to partner with different regional healthcare providers. And then from those partnerships, they started launching teams that provide health and social supports for older people in the neighborhoods around their buildings. So not just their own tenants anymore, but also nearby people. So it's kind of a fascinating thing. And of course, Toronto Community Housing Corporation had to have resources for this to happen and presumably federal support, but it's really neat that it was able to build that up over time. Next slide. So I know that was a lot of information, but if you'd like to learn more, you can find the report on our website or feel free to reach out to me. We're also hosting a series of webinars right now, which you can learn more about on our website. Yeah, thank you very much. Let me know if you have any questions.
Thank you so much, Bailey. That was so interesting. And, you know, I know a lot of us in this group have experienced working with seniors and people with disabilities, and, you know, have, you know, are confronted with a lot of the issues in dealing with our clients that you cite here. So it's you know, really nice to see the compilation of getting the issues out there and why it is really need to look at it comprehensively. And then the examples that the 3 examples that you shared with us, and, you know, how can we take this information and, you know, learn from it, and how can we apply it, you know, in our own area here in Maricopa County. Are there any questions from the committee for Bailey? Or comments?
This is Rachel Sanders from the city of Buckeye. I just thought it was so interesting how the food and the meds and the vaccines were brought to the communities in the different areas. I just thought that was amazing. It would have been great in our area because we do have some rural area. If we had been able to do some of that, that would have been great. But I just love those examples. Thank you.
Yeah, that's interesting to know. For sure, like rural areas have different challenges, of course, in delivering services, and that's something that we were kind of trying to think about during the pandemic, because we saw a lot of really great things happening, but obviously not every community can do the same thing. So trying to imagine what that looks like for an area where people are really spread out is, I think it's a really interesting question.
Yeah, but Bailey, I think that's something that we look at here in Maricopa County, because we are this mix of urban, suburban, and rural, and folks on this committee have, you know, representing each one of those areas. And so it does make, you know, whether it's issue or any of the other issues, a little more complex for how we work together. But I really like like I said, the options that you give, and seeing how we can apply that in you know, the different settings here is important. Any other comments or questions for Bailey? All right. Well, thank you, Bailey, again for joining us. I really appreciate it. I can't wait to share your presentation and these slides with my staff members in my organization. I know that they're going to find it very beneficial as well.
Thanks for having me.
All right, members of the committee, we will move on to agenda item number 5 now, and that is the Social Services Block Grant Funding Allocation Recommendation. So we, as Kelly had shared, we did have a special meeting last month to discuss potential recommendations, and really this was to help facilitate, because of the timeline that we do have to meet to make these to make this recommendation up through the different committees here at MAG, and then get it back over to DES in time. So notes have been included in the documents that Dylan had sent out to everyone on how the decision was determined for the recommendations to be brought to the group, and shelter and food security were prioritized due to the really dramatic increases in those experiencing homelessness and individuals requiring home delivered meals. So Kelly or Dylan, would you mind sharing the document on the screen? And then I'd like it to open it up for discussion from all the members. For those who did not have an opportunity to attend the special meeting, are there any questions that everyone that those folks have?
Madam Chair, do you mind if I jump in for just a moment?
Yes, please.
So as a reminder to committee members, from this vote, then the Chair Edwards will then go to the Human Services Community Initiatives Committee with your recommendations, and they will vote on your decision making. And then it goes to Regional Council for a final vote, and then it goes back to DES with your decisions, just so you know what the formal internal process is. Thank you.
Thank you, Kelly, for sharing that with everyone. All right, are there any other questions or comments from the members? And if not, is there a motion to approve the SSBG funding allocation?
This is Christina Panatescu. I'll move to approve.
I'll second.
Thank you,
Melanie
Christina.
Gilbert.
Thank you, Melanie. Great. Kelly, would you please take roll call?
Madam Chair, just one moment, please. Okay. Cindy Savarino on behalf of Mary Lynn Castle.
Aye.
Thank you. Jerry Guajardo.
Aye.
Thank you. Rachel Sanders.
Aye.
Thank you. Karen Bishop.
Aye.
Thank you. Melanie Dykstra.
Aye.
Thank you. Christina Panatescu.
Aye.
Thank you. Renee Ayers Benavides.
Aye.
Thank you. Kristen Charlau.
Aye.
Thank you. Eliana Guadino, excuse me.
Aye.
Thank you. And Chair Edwards.
Aye.
Thank you.
All
Passes
right.
unanimously.
The motion carries, and really want to thank everyone. The conversation that we had last month was a really wonderful, detailed conversation, and I appreciate everyone who had the opportunity to attend, everyone's comments, and to get us to the recommendation today. We know that this is really the primary purpose of the HSTC is to review and make this recommendation for the social services block grant funds. And so thank you everyone for your time and commitment to the process. And, you know, as we had shared in the last meeting, you know, we'll continue. I know Kelly's been committed to it, just as Mag always has been too. You know, solicit more information from DES and do whatever we can to make sure that the committee does have as much information as possible. So thank you everyone for your time and really energy on this one.
Madam Chair, could I jump in real fast?
Please do, Kelly.
We will be scheduling hopefully quarterly meetings with DES to review this funding. So for the next funding year cycle, we will have additional information and hopefully a better relationship as well.
This is super news. Thank you, Kelly. That's great. Thank you for doing that. All right. Well, we will move on to agenda item number 6. So this is for our committee's discuss membership openings for the chair and vice chair. Right now, we do not have a vice chair. That's after our former vice chair, Jason Matthews, left his position at Valley of the Sun. and is working here in Maricopa County Human Services Department. So he vacated as the vice chair of the HSC. And after the end of this session, my role of as chair will end. So really want to have the discussion that, these are, they are one-year terms, but can be extended, and really for everyone to know, since we do have so many new members, that the time commitment includes both attending these every other month meetings and approving agendas beforehand. Typically the chair and vice chair, along with MAG staff, will have discussions on the priorities outside of SSBG approval for the committee, other things that can be brought and discussed and shared with one another. So there may be some other offhand meetings there, but I will share that it is not like a significant time commitment to chair and to be the chair or the vice chair, and would really appreciate volunteers to come forward for these positions. So if anyone has questions as well, happy to answer those. Christina is our past chair, and I know that I can put Christina on the spot. I'm sure she would be fine in answering questions as well. And of course, Kelly and Dylan here representing MAG that can share perspective or answer questions too. So anyone have questions or potentially considering volunteering for these roles? Please. All right, well, I see everyone is like thinking really hard about this. Please reach out to Kelly, let her know if you have interest in this. I've been on this committee myself for almost a decade now, and I will tell you that from my experience as chair and vice chair, and certainly as my experience as a member and witnessing and being present for the prior chairs and vice chairs, that it's a great committee to be able to lead and bring together really subject matter experts across our region and share information and learn new things like we did today. So please put some thought into it. We, like I said, would really sincerely appreciate volunteers for these positions. Kelly, is there anything else you'd like to add to that? Other than saying please again to everyone?
Respectfully, Chair, I would say I think the time commitment of attending as a member versus attending as chair is very similar for both the chair and the vice chair. There are not additional meetings or additional significant time commitments. The chair and vice chair are sent a chair agenda several days before the meeting, so you have notes to review ahead of time. Really, that is the major additional ask, other than your leadership of these meetings. And you have MAG's full support for all the other details. So
Thank you, Kelly.
And I think we do have something in our policies. If we don't get a chair and a vice chair, I think it ends up being me, and I would love your help.
Let's not do that to Kelly. She does a lot for us. So like I said, it's a great opportunity to be able to lead the committee. And there's been, it's really as much, there's additional time you want to put into it. It's an option. It's not a necessity, as Kelly had shared. So All right, folks, we'll go ahead and move on to agenda item number 7. Are there any requests from our members here on a future item? Anything you'd like for us to discuss in the future, or specific presentations that would be really beneficial that MAG could help facilitate identifying a speaker and someone to bring information to the group? Melanie.
Well, I know some of us, and I'm guessing since we're the technical committee to the Human Services Committee, correct?
That is correct.
Sometimes when I pull those agendas, the expectation is that I will be able to potentially brief our council member who's attending those, and we haven't necessarily always seen the stuff that's going to them. And so I guess I would like a better flow of information so that I can do a better job of briefing the council member that's going to be attending that meeting, especially if it's something they're taking action on. Obviously, SSBG, we know it moves there next. So I will say, we talked as a committee's in agreement, give it a thumbs up type of thing. But I don't always know what's going to be on the other one. So if there's a way to kind of facilitate that better for us on this side before it gets to there, that's what I would ask.
That is excellent feedback. I really appreciate that. We would be more than happy to make that accommodation.
Great point, Melanie. Thank you. Other items?
Madam Chair, I have 2 announcements, if that's okay.
Yes, please.
One is, in a previous meeting this week, we heard from a new colleague at US Vets. If any of you are familiar with that organization, they're a nonprofit that specifically caters to veteran needs across the region. They're a national organization, but we have a branch here in our region. They have a new housing option for female vets. It's called Ashley's House. So if you have individuals in your cities who are females and who are veterans, I'd be more than happy to send out the contact information for that. We're always excited when there's new housing options available. Furthermore, with our partnership with DES on our, I always get this title wrong. It's a grant that helps seniors who have dealt with domestic violence, who are fleeing domestic violence, get reestablished on their own. And there's housing vouchers. There's hotel vouchers that are now available through that program as well. So I will also send that information. It's available, I believe, to anybody over the age of 55, and I will confirm that as well. They have not had, I think they're a little bit nervous to announce that too broad because there's only so many vouchers in the program, and yet they have not had the response that they were expecting. So it's kind of like trying to figure out how to open the fire hose just enough. So I will send that information out to you as well. And then the final announcement I just wanted to make is my colleague Dylan Belmont, who many of you have gotten to know, who has been just an outstanding administrative assistant for the Human Services Division since I believe he started in March, was promoted last week and is now on our homeless planning team. And so he is pinch hitting and helping staff this for the time being until we get a new admin in place. But we're really thankful to have him move over and start working on homelessness for us regionally as well. Thank you.
Thank you, Kelly, for those updates, and congratulations, Dylan. No, we're so excited for you and for you to be supporting on all the homelessness initiatives and work that MAG has been doing.
Thank you so much, Chair Edwards. It's really been a pleasure working with you all.
All right, if anyone has thoughts on a future agenda item, please reach out to Kelly, shoot her an email. Kelly's really super in trying to meet our needs and bring worthwhile presentations to us. So if you have any ideas or presentations you've heard in other capacities that you think would be wonderful to share with the rest of the group, like I said, share that information with Kelly and she'll help facilitate getting those set up. All right, well, now we're on to agenda item number 8. So this is the comments from the committee. Are there any comments or announcements from membership? I'd like to open it up to everyone.
I have one more, although I am not a member. I apologize.
No, don't apologize. We love your updates, Kelly. Go right ahead.
One of the major concerns we've heard through the Human Services Community Initiatives Committee, which is where many of our elected officials serve, is the social service needs that are more complicated when we host the Super Bowl, which will be here in February. And we have had several presentations on human trafficking in that committee. Also, there has been concerns about homeless individuals being moved during Super Bowl to improve appearances, et cetera. We're more than happy if you all are interested in having a further dive on the social service needs and how they may be addressed before and after the Super Bowl. We would be happy to accommodate that as well. I think we have Barrett Jackson, the Phoenix Open, and the Super Bowl all that week here. So it's a great time to go on vacation if you can.
I was thinking the same thing. Everyone wants to work from home that week. That would be great to help, the information that you've shared with that committee to share it with us too, Kelly. Appreciate it.
Sure.
All right. Anything else for the good of the order before we adjourn? All right, super. Well, thank you so much, everyone, for your time today, and your time previously, especially with SSBG. Our next meeting of the Human Services Technical Committee will be on Thursdays, December 8th at 2:30. So, with no further business, today's meeting is adjourned. Have a wonderful day and a great week. Bye-bye.
Thank you all very much. Thank you.